President Obama joining Hillary Clinton's call for a public health care option. Former New York Lieutenant Governor Betsy McCaughey says a single-payer system is the goal for Democrats. Betsy, we've heard this all along. It just feels, though, that the Obamacare is failing so badly that it's hard to believe that this was the way it was designed, to fail so poorly that they would get ultimately they want. But that's where we're heading. Well,
actually, what seniors need to know is that this proposal for a public option, as well as Hillary's proposal to expand Medicare to people in their 50s, this spells immediate trouble for seniors, never mind what the long-term goals are. Let me ask you something. If you were having trouble feeding your family, would you invite the neighbors in for dinner too? Of course not. Seniors are already having trouble finding doctors willing to take low Medicare rates. So now Obama and Hillary are talking about creating a public option plan that will also pay doctors those low Medicare rates. That means millions more people competing with seniors for those same doctors willing to take those low rates. And then if Hillary expands Medicare to people in their 50s, millions more people competing to get into the offices of those same doctors. Seniors will not be able to get care.
This is the logical argument you made before Obamacare was pushed through. And it made sense, obviously, more people, fewer doctors. And we've seen a result of that, concierge services. If you love your doctor, you won't be able to keep your doctor, and prices have gone through the roof. And yet they were still able to push it through. Where do you find that the compassion argument? Because that seems to win over at least a segment of our population. You know, you talked about inviting the neighbors over. They're saying, what if you are the neighbors with nothing to eat? Who takes care of them?
Well, it's one thing to provide coverage for your neighbors, for people who don't have it. I think we all share the feeling that everyone should have access to health care. But it's very cynical to keep reforming health care on the backs of seniors. Medicare is already in a crisis because 30 million more seniors will be coming into that program in the next decade as the baby boomers age. And yet the president has already taken $716 billion out of Medicare to pay for Obamacare, and now Hillary wants to make more public programs still on the backs of seniors, and seniors have had enough. They're already having a really hard time getting care.
And the bottom line, what we've seen with young people is that they've decided to pay a fine with respect to Obamacare. They're not going to step up. The millennials are the largest age group in this country, but either they won't or they don't have the wherewithal to step up and fill that void.
The president's latest lie about health care, people have better coverage. They don't. When you have a plan with a $6,000 deductible and you're a young man, you're never going to get $1 back on that plan.
Real quick, the chances we ultimately could have a single payer in this country.
That all depends on who gets elected in November. The Democrats are intent on driving us into that system, and that would be a real problem for people with cancer because single-payer systems have low cancer survival rates.
All right, Betsy McCaughey, thank you very much.